Hello, YouTube world, my friends, family, colleagues, my viewers, and my subscribers. Welcome back to Rebirth. The last segment that I had on Rebirth, we talked about mental health, and I'm drifting a little bit towards some other things. I want to talk about viruses a little bit more, but I was looking at some research I was doing, and I noticed that during that research, I saw some similarities in viruses and diseases. And then I also like to look into what a lot of doctors are researching. So I noticed that they talked about 5 diseases that that you can catch from a kiss, a simple kiss. So they talked about 5, but I thought that, 4 would be enough for right now in this segment, because we're not going to go into deep detail, but we're going to touch on a little bit. According to the research that I've done, determined by blackdoctors.org, they say it's imperative to know the sexual health, and they think that it is important to have knowledge of your partner's sexual health and their transmitted diseases status, whether or not they had it before, and maybe, cleared it up, and, just having that knowledge can be a big game changer when you talk about your own personal health. So they think it's mandatory, and based on research, they have learned that a simple kiss can be the cause of transmitting diseases from one person to another. And they talked about some diseases or viruses, that can be transmitted by a kiss. So I looked at 4 of them, and I was like kind of surprised, because we don't talk about these things anymore. We all caught up in these other things in these other areas. The coronavirus had all of us tied up for a long time, really just worrying about it, until we kind of like, things are slowing down, things are getting better. I want to admit that. The vaccine is still questionable. Reason why I say that is because there's a lot of people that have close friends or loved ones that, after taking the vaccine, they had some side effects that wasn't good. So people are still a little bit weary when it comes down to whether or not they, indecisive, and they, it's like weighing them down, because they want to do something. And this is what I want the medical world to know, the scientific world as well. A lot of people want to do this. It's just that they are afraid, and rightfully so. And let's not beat them up because they're afraid to take a step towards a vaccine that may or may not be harmful to them. Regardless of the numbers and the percentages that says, we have so many people that are being helped, and it's dropping the numbers of cases. And that's true. But we all know that when a virus runs its course, the number's going to drop anyway. And the vaccine does help. Vaccination does help. But I want to say that you cannot change the mind of people that are afraid. Okay? So we're going to start with these different types of diseases that you can catch from a kiss. Now, periodontitis, that is one. The Journal of American Dental Association, they states that periodontitis may possibly be passed from parents to children and between intimate partners as well. Now, it inhabits the periodontal pockets. And also, it presents on oral soft tissues, okay? Teeth, gums, and saliva. That's the presence of it. That's where you will find it. They also say that it can be transferred from one person to another through the saliva, intimate kissing, and sharing of food, sharing utensils when you're eating food, and when some people share a toothbrush. Go figure. But they're warning you against that, because today we live in carefree lives when it comes down to dating. And, you know, I look at people now, how they go about with all these new different types of dating schemes, where women now are sharing multiple boyfriends. You know, they call it polyamory. So, you know, you can go and visit someone, and it can be a young lady and she got 2 boyfriends. Wow. I mean, go figure. All I can say, be careful. Moving on, herpes. That's number 2. Now, herpes, if you will, is caused by the herpes simplex type 1 strand. And this can cause genital herpes. They refer to this as oral herpes. And this is commonly referred as, you know, relating to cold sores, fever blisters. Now, a lot of people don't understand that there are a lot of people in the US today that has oral herpes. They have oral herpes and they're unaware of it. And that's not good, because when you're moving about and you're doing the things that you're doing, and here you are with the herpes virus and not knowing about it, you got to think about that. And it tells us that it is transmitted through direct contact between an infected area or broken skin or a mucous membrane. The symptoms aren't always visible, and it states that 50+% of American adults population has oral herpes. Experts, specialists in the field, they estimate that over 20% of new genital herpes cases are caused by the herpes simplex type 1 virus, and it is transmitted through oral sex. Got to think about that, people. I'm just saying. I mean, monogamous relationships ain't bad. Being monogamous ain't bad. That don't mean you're a simp, guys. It just means you got to pick the right woman. That's what that means. Being monogamous is not a bad idea. It's just saying that you need to pick a woman that's not thinking like a man. Those of you that know where that phrase come from, think like a man. Let me tell you something, I don't want a woman that thinks like a man. That means she's gonna be running around out there doing a whole lot of things. thinking like a man. But I'm gonna leave that alone. Moving on. Let's let- let's let's try to wrap this up. Trying to stay focused here. But one thing that you must understand about the herpes simplex, one, it can move to stage 2, herpes simplex 2. And I want you to understand that that's when things get serious. That's more genital. And, you want to make sure that the person you with is clean. Just keep it real. Deal with clean people, you know? Um, it's not that hard. So just remember this, once you get it, some people say there is a cure. This is in some professional arena. They're talking about a cure. But as of right now, there is no cure for herpes. There are what they call a homeopathic treatment. And they believe that if applied, if the treatment is applied properly, if all instructions are followed properly, there's a chance that you may get rid of it. This, go figure. I'm not trying to catch it. That's what I'm saying. Anyways, that was number 2. Number 3 on the list is syphilis. I don't talk about syphilis that much anymore, but it's out here and it's doing its thing. Syphilis is it's a condition highly infectious, but it has open sores, which are round, and when they're combined, it makes up syphilis transmissible through kissing. So you can transmit syphilis through kissing, because basically what they're saying is in the saliva. The bacteria that it produces is in the saliva. And when you open mouth kissing, you're trading off those juices. The salivary gland do not stop working just for a simple kiss. So you have to really think about it. Know your partner. But it also says that kissing is not the most common way to transmit this, although it is a way to transmit the disease. But the most common way to transmit this disease is through oral, anal, and vaginal sex. This grown folks talk now. This is grown folks talk. And I want everyone to know, be aware. This is why I want to raise the awareness of health. This is why I love what I do, because I get to be one of the professionals in the field that is the voice crying out in the wilderness. There's so many of us doing it in various different ways. This is the way I do it. And I'm trying to up my game a little bit, trying to do better. But this is the way I raise awareness, Think about it. On an average, there may be around about 34,000 to 35,000 new cases a year of just syphilis alone, among other diseases, but syphilis, 35,000 new cases. Good thing about syphilis, there's a cure. The right treatment plan and the use of antibiotics can clear it up. But remember, the damages that syphilis caused cannot be reversed. Remember that. You can cure it, but the damages that it does to the body remain. My fourth one for tonight, strep throat. Who would have figured? When you talk about strep throat, you're mostly talking about children, because we talk about children between the ages of 5 to maybe 14 years of age. You know, some professionals say 5 to 9. I'm willing to go to 14 because I know grown people that get strep throat. So these are the ones that most commonly be transmitted to getting this disease, and they are ones that you find out more and more that, you know, kids got a child have strep throat. That's why they ask them to keep them at home. Whenever you hear a child saying, you know, they find out a child has strep throat, they say keep them at home. Let's not, you know, do too much. Keep them at home, because it's transmittable. It's a bacteria. And the thing about that is similar to what was going on with the coronavirus once they found out that it can be airborne. And that's the reason why they were saying when you cough, cover your mouth. When you sneeze and cover your mouth, you know, cover all this up. Then they had us wearing masks, which I thought was one of the best ideas that they come up with. I don't know why a lot of people kicking against that, but let me tell you something. You got people walking around with all kind of nice looking masks. Some of them saying got little nice sayings on them, you know, stuff like that. All that is cool. I was able to work through all that because I'm a healthcare professional, but you know, it's the idea that we were able to go work, be safe, keep covered up, you know. So I don't have a problem. Yes, I would love to see things get back to normal, but yes, I want to live. And those are two yes I deal with. I want things to get back to normal, and yes, I want to live. And knock on wood, thank God, I haven't been laid up in the hospital. So I want to just say that when we talk about these diseases and how they are transmitted, keep in mind, you can do preventive measures. And it's just like they say, you know, cover up. If you feel like you have those symptoms for strep throat, stay home. And even when you're home, cover up. Don't spread it. But strep throat is like tiny droplets containing the bacteria, and once released into the air, someone else can breathe it in. You can pass it on, it's got to go through an open orifice though. So coughing, kissing someone, sneezing on people, things like that is not good. This bacteria are highly contagious, and they spread through airborne droplets. That's that mist that comes out your mouth whenever you sneeze or cough, it coming out. Those are the droplets. And it goes in somebody else's face. And if that person is talking to you and you accidentally just cough or sneeze right there, it going into their mouth. Thank God for the mask. I still wear mine. I ain't with these hard-headed folks. I'm still wearing mine. Anyways, moving on. There are about 11,000 to 24,000 cases of strep throat disease that occur each year. This is according to the CDC, Center for Disease and Control. I cannot say it enough. We have a lot to be thankful of that we were able to have a vaccine to fight against the coronavirus. And we are doing well as far as a whole, as a nation, America, fighting this disease. I thank God for all the people that work hard in healthcare and mental health as well, doing our part. Remember, there's a lot more going on out here. And I wanted to say, be safe, stay safe. This is Robbie Williams. If you like, click the subscribe button, notification bell, continue to get videos that is raising the awareness of health, good health. And I appreciate all my supporters, subscribers, and viewers.